close and personal view. And welcome back to the JoAnne Powell Show. I am JoAnne. We are coming to you from the World Center of Broadcast Media, WCOBM.com, Hollywood. And for those who are tuning in on the Go Harrison Show, I'd like to thank you for joining us as well. A lot of people are very concerned about what's going to happen to the Affordable Health Care Act. There are 20 million Americans who basically depend on this form of health care to reach their medical needs when it comes to various issues about them needing to go to the doctor, the hospital, just various issues when it comes to health care. And not knowing what's going to happen has a lot of people very concerned and wondering what is the next step for them. Well, my next guest, who's also joining me via the phone, has, as a part of an organization that is really spearheading universal health care, and that is Martha Kuhl, who is with the registered nurse. She's a registered nurse, and she's also a pediatric oncologist nurse at the Children's Hospital in Oakland, and she's also the secretary-treasurer of the National Nurses United. And your organization was a part of a rally. Rallies going on in Los Angeles and cities across the country, where people kind of gathered over the Martin Luther King weekend to voice their concerns about this issue of health care for all. And your organization has an interesting position on that. But first, tell us a little bit about your organization.
Well, as you said, I'm a registered nurse and a member of National Nurses United, and I've been working as a nurse for over 30 years, and I see patients every day, and I was working yesterday evening, but I was lucky enough over the weekend to be at a conference regarding health care, and it's the hot topic right now that the Republicans want to repeal the ACA. And what we were doing over the weekend, we were honoring Martin Luther King, since one of the things he said, that one of the most unjust things about our society is that people aren't guaranteed health care. So we linked the struggle for everyone's rights to all of our rights to health care.
Now let's talk about one of the issues and one of the healthcare plans that you guys are promoting, which is basically Medicare for everyone, kind of expanding a program that's working already in our country.
Yes, we think that the ACA was an improvement over people not having health insurance, but it doesn't actually guarantee care. Many people still can't afford their co-pays, their point-of-care co-pays, their deductibles. They can't go to the doctors that they want. And we know we already have a system in place in America for elders, for people 65 and up, and for disabled people. It's called Medicare. And that is a publicly financed and administered program that guarantees access to health care for everyone in those populations and age group. And we think a simple way to go forward from the ACA to make sure that everyone has health care is to ask for Medicare to be extended to all ages, from cradle to grave.
Well, I know Congress has already said that they will be repealing the Affordable Care Act, and there also has been some talk about trying to privatize Medicare. What are your thoughts about that and the impact that would have on the system the way it is, and what your organization is hoping for the future?
Well, right now we have a system that's privatized. Everyone has to buy private insurance, or they get private insurance via their employer, or they get a government subsidy via the ACA to buy private insurance. And that system isn't working currently. So to make Medicare, which is working currently, which has a lower administrative cost, which has increased longevity amongst our elders since it's been implemented over 50 years ago and is very popular. No one wants to lose their right to health care and Medicare. Since we have a system that we know works, we believe that as even Trump said, when you repeal the ACA, there should be a replacement. And we think that privatizing Medicare will not replace the ACA, but expanding Medicare as it is currently publicly financed and administered to all ages is the way to go. I want to say that as a nurse, every day on my job, I find patients who have delayed care, have come to the hospital too late, who end up in the emergency room, who don't have insurance still, and the current system of private insurance isn't working. So we think that for everyone to get the health care they need, and when you're sick, you don't want to go out and buy a plan, right? So we think for everyone to be guaranteed the health care they need, we should expand Medicare to everyone.
And I know there are a couple of issues regarding the Affordable Care Act that Congress and most everyone seems to like. That's you can receive coverage regardless of pre-existing condition, and that your children can stay on your plan up to the age of 26. So moving forward, what type of feedback are you getting from those on Capitol Hill when it comes to proposing the expansion of Medicare?
Well, I have to say that Medicare covers both those issues if you do it for all ages, right? You'd be on your health, you wouldn't have to be on your parents' health plan, you would be on a health plan. And two, it covers pre-existing conditions currently, right? When you turn 65, regardless of your health status, you get Medicare. Now, as far as legislature goes, we are going to push all our legislators across the country. RNs don't give up on our patients, and we know this is a difficult fight in this political environment, but we know that the vast majority of people believe that when people are sick, we should care for them in our society. And that that's certainly a registered nurse belief. We don't care whether or not you can pay. We don't care what kind of insurance you have. We're going to give you care, and we don't give up on our patients. We're not going to give up on the legislature. We're not going to give up on fixing our healthcare system so we're all guaranteed healthcare. We're not going to give up on our society where we should have healthcare as a human right.
What advice would you give to people who might be watching or listening on what they can do to take part in something to let their Congress members know and the president know what basically their thoughts and desires are?
I think I would maybe circle back to what we did over the Martin Luther King weekend. We were not just registered nurses, but many other activists, many people concerned about healthcare, many people concerned about the environment and its relation to health, many people concerned about racism in our society and unequal access to healthcare. We're in the streets around the country at Congress People's Office or in various public locations to draw attention to this. And we want to thank the media for covering it as much as they did. And there was thousands of people in the street across the country. And these were events called on by Bernie Sanders. Mm-hmm. And we've seen the popular upsurge in action on this. And we will not only be doing events in the street, but we are getting people elected locally. We're getting people involved in the Democratic Party. We can hold our legislators' feet to the fire on this issue through joint actions, through setting up meetings with them, through letter writing, through social media campaigns. We think there's a lot that can be done to make sure that eventually we have all can share in the right to health care.
Well, once again, I'd like to thank you for joining us on the show. And also this weekend, on Saturday, there is a big rally in Washington, D.C., the Women's March on Washington. And most local cities, including Los Angeles, there will be a rally on Saturday in Pershing Square from 9 to 4 o'clock. So if you're interested in participating in that, if you can't make it to D.C., check with your local city and find out what's happening there and let your voice be known.
So. If you are an adult that began college and has not finished your college degree, let me put it to you straight. If your lifestyle and your standard of living is not becoming to you, then you should be coming to us, Oakwood University Elite Program. We are the fast, flexible adult degree completion program for the busy adult, like you.
Register today. Go to oakwoodleap.com or call 256-726-7098. It's time to leap.
For years, people have trusted McKay's Family Mortuary. We're part of your community and we'll take care of the details. We offer a variety of memorial services, including sea scattering and cremation. According to the Federal Trade Commission, the average funeral cost is over $9,000. We have complete funeral chapel service starting at only $31.25, casket included. Direct cremation starting at only $9.95. Visit one of our 5 locations and meet our caring and diverse staff. McKay Family Mortuary. Let us be the shoulder to lean on.
Thanks to Oakwood University and the LEAP program, I have now a college degree. So to the Spanish-speaking members of this community who feel that the LEAP program is something you should consider, I would say, ánimo a la universidad. Considere el programa LEAP de Oakwood University.
Go to oakwoodleap.com or call 256-726-7098.
Seize the day scuba for your best scuba experience above and below the sea. You'll find friendly staff, experienced PADI certified instructors, and state-of-the-art scuba equipment and gear. Join our dive club and we'll help you plan memorable scuba excursions. Immerse yourself. Seize the day scuba, serving Southern California. Call 949-220-0500 to create your scuba experience.
When I first started into the program, yes, I had doubts. I was really impressed with Oakwood University, with the faculty and the staff and the student body. It was a really good experience, and I would definitely recommend it to anyone who was thinking about going back and finishing their degree.
Register today. Go to oakwoodleap.com or call 256-726-7098.